Time for the KBOI Medical Moment, brought to you by Regence, featuring Dr. Mark Hiatt of Regence Blue Shield of Idaho. Dr. Hiatt, good morning to you.
Good morning, Chris and Paul J.
Morning, Doc. We hear about these kinds of stories from time to time, stories of a surgeon leaving a sponge or a medical tool inside a patient only to have it discovered months, maybe even years later. Is this really a big problem?
Unfortunately, Paul J., it is a bigger problem than we think. In this country, about a dozen sponges and other surgical instruments are left inside patients' bodies every day. And so if you do the math, that accounts for about 5,000 such cases each year in this country.
What types of things are generally left behind?
Chris, usually it's sponges. A lot of sponges are used during major surgeries, as many as 100. And so approximately 70% of the surgical items left behind are sponges. The remaining are surgical instruments, such as needles, clamps, retractors.
What kind of problems result from these items being left inside a body?
Well, the biggest thing is discomfort. You've got something inside you, it causes localized pain, but it can also cause bloating. In some cases, unfortunately, these retained surgical items can actually lead to sepsis and even death.
Doctor, I know nobody's perfect, but why do these mistakes happen?
Well, Chris, you can imagine that surgery is a very stressful time, and these errors are likely to happen when there's a high-stress situation, such as during, in particular, an emergency surgery, or when the surgeon unexpectedly changes his or her procedure. And distractions can also lead to these errors. And also remember that surgeries are complex. As I mentioned before, it's not unusual to use up to 100 sponges in a major operation. And so if you ever try to count the number of cards in a deck, you know that a certain number of times you're not going to get to 52. It's very common not to count correctly, and this happens, unfortunately, occasionally during surgery.
One of the things in the last couple of years topping the news, concussions. Now, we've spoken before about concussions. I understand the FDA has approved a new way to detect them.
That's right, Paul J. The United States Food and Drug Administration has, for the first time, approved a blood test to help detect concussion. Concussions, of course, as you know, may be sustained by soldiers on the battlefield, by athletes on the football field, and we currently diagnose those concussions based on a combination of symptoms as well as imaging. But this new blood test may be a very beneficial way to very quickly diagnose concussion in adults.
How does the test work?
Well, the test measures two proteins that may leak into the bloodstream following a blow to the head. And elevated levels of these proteins can be detected very quickly, within 15 minutes after injury to the brain. And furthermore, Chris, they can remain detectable in the blood for about 12 hours following that injury.
What are the advantages of this new test?
Well, you can imagine that speed is one thing that's an advantage. This blood test may be able to evaluate the presence of concussion very quickly, and it could do so in a sensitive manner. And it can even do it relatively economically, because you may be able to spare that injured athlete or soldier the unnecessary subsequent imaging, which, is, of course, the high cost of that imaging as well as the radiation delivered.
Doctor, what do you expect? What is the future of this new test?
Well, the manufacturer of this new blood test, Chris, is hoping to make this test available to emergency departments by the end of this year. And it hopes to make a handheld device of this blood test available sometime in the future for the benefit of people on the battlefield and the soccer and football field.
Well, Dr. Hiatt, we thank you so much for your time this morning, and as always, every Tuesday right here on KBOI.
Thank you.
Thanks, Doc.